for now, again, just keep in mind to use the Q&A feature for any questions that you have. And this is intended to be a safe space. So please just be courteous to each other. And, it's hard to be vulnerable in front of strangers. It's certainly hard to be vulnerable about issues surrounding mental health, but we want to make sure that we create a safe space for everyone involved tonight. So just keep that in mind to be respectful of each other. And you should also know that this session is being recorded. The goal of that is not to violate your privacy. It's more so to be able to use this for educational purposes later. So just be aware of that. And then lastly, let's increase our awareness of mental health issues. Again, May is Mental Health Awareness Month, so it's just appropriate, obviously, to be able to jump into this. And I thought that one way to catapult this conversation would be to actually talk a little bit about all these different letters, because I think that in an effort to have more awareness about mental health, it's important to understand that there are lots of different healthcare providers or mental health care providers, and yet it can be a little bit confusing as to who they are, how they are different from one another. So, in a very superficial way, I thought that it would be nice to kind of just talk about some of these things. So, social workers, you might see LCSW associated with their name, their professional title, and that stands for Licensed Clinical Social Worker. We actually have two social workers on our panel tonight. And so, social workers are some of the individuals who can help and provide mental health care or therapy. Professional counselors also do this. You will sometimes see LPC with their name, licensed professional counselor, or LMHC, licensed mental health counselor. And both of these professionals can provide care for mental health issues. I think that one way, again, very superficially, to try to differentiate them is that social workers have the social resources that are a part of their training and their experience. And so sometimes their mental health therapy or treatment can be contextualized for the folks who may additionally have, housing needs, or may have, childcare needs, or other things that perhaps go hand in hand with some of the mental health issues that they're dealing with. But both of these are people who can provide mental health care for whatever issues you may have. Marriage and family therapists kind of goes along with the name. They tend to focus on those demographics, those who are married and those who may need have needs with regard to their family. Psychologists have doctorate degrees, typically doctorate degrees, and they can be various ones. And so you have PhD, Psych D, sometimes even educational doctorates. But these are individuals who very often are involved with testing with regards to psychological diagnoses and treatment. And so, for example, these are some of the people who might be helpful in diagnosing people who, for example, need gifted classes and might need individual education plans. Sometimes psychologists are actually involved in doing that. And also testing with regards to, again, specific psychological diagnoses. They can also offer therapy and treatment, and sometimes that may be coupled with specific kinds of therapy, like cognitive behavioral therapy or psychodynamic therapy. And so, again, just a different kind of provider, and sometimes with a specific focus. And then psychiatrists and psychiatric nurse practitioners. These are people who are more on the medical and specifically medicine side of the psychiatric disorders or the mental health issues. And so these are typically MD or DO, medical doctors, or nurse practitioners. And so these are people who are specifically also going to be managing medications with regards to the different mental health issues you may be experiencing. And they can often work in concert with some of these other providers, since they're the ones that actually prescribe medications. So again, just on a very superficial level, a way to be able to distinguish some of the different mental health care providers. And hopefully, as a result of your experience tonight, you'll get a chance to learn some more about different kinds of providers and how they can be helpful. So with that, I can actually stop sharing my screen. And I now want to take this opportunity to start asking some of our experts some questions. So you feel free to start using the Q&A feature now. And as I said, we'll be checking that over the course of the forum to be able to introduce your questions as well. So let's start with Ms. Demetra Chandler first. So how can you tell the difference between normal stress and an actual mental health condition?
Yes, for some reason I feel like I knew you were going to pick me.
Mm.
But yes, good question. So stress is something everyone deals with in their daily life when it comes to parenting, work stress, and even simple as just maybe driving or just our day-to-day daily needs when it comes to just taking care of the household or things like that. And that's normal stress, or even just different life changes that we might go through. And that stress typically can get better over time when our situation gets better over time or when we're practicing healthy coping skills. And what I mean by coping skills is like running or exercising. I say running because I like running. But exercising or journaling or anything that we typically like to do that's healthy, that makes us feel good. And stress is supposed to typically get better over time when the situation gets better. It starts to look more of a mental health condition when the stress and symptoms starts to intense and it's lasting longer. So, looking, for example, it might start turning into anxiety or depression. And the biggest warning sign is interfering with our daily functioning. So it's hard for you to get up in the morning, you're isolating, you're not motivated anymore, you might not be able to go to work. And again, I'm not saying that even a mental health condition can't be improved after a period of time, but just those differences there is when it starts becoming more intense, long lasting, and it's interfering with your daily functioning on a daily basis. So yeah.
Got it.
Mhm.
Thank you. It sounds like, a consistency of problems. And then, like you said, really starting to interfere with your ability to function.
Right.
That's where, may be becoming more of a serious issue.
Yes,
Fair? Okay. All right.
absolutely.
Thank you.
Mhm.
All right. And then let's see here. How about Brother Watson? Um, I think that, particularly in the Black community, but I think that this is just an issue for a lot of people. It seems to be difficult sometimes to be able to reconcile religion and mental health and health in general. We find ourselves sometimes at a crossroads when it comes to those two things. I was hoping you could speak a little bit to, how you have come across that in your profession, and do you find that people struggle with even bringing up their religion when it comes to talking about their mental health? Is that an appropriate place to deal with both?
Yes. With and I find that in my practice that a lot of clients bring their religion to the table, and I welcome that because in our code of ethics, as long as I don't push my religion on someone else, I can help a client get through some of the challenges that they may have, probably within the church or just mental health in general. But I usually incorporate it in treatment if the client is a religious person, whatever that religion may be, whether they be Muslim, Jewish, Catholic, whatever the religious denomination is. I find that it's very helpful in treatment to incorporate it because it adds another protective factor, which as a therapist, I like protective factors are factors that people bring to the table that make them more functioning and less likely to engage in suicidal behavior, but it